This is a demonstration for removal and application of the central line dressing kit. The equipment that you'll need to perform the central line dressing change includes dressing kit, extra chlorhexidine cleansing swab, extra clean and sterile gloves, and extra masks for any family members who will be staying in the room. First, explain the procedure to the patient and check patient identifiers, including name and date of birth. Wash hands and don gloves. Open the white portion of the dressing kit labeled 1 removal. Leave the blue dressing pack within the plastic wrap. Your dressing kit will include 2 masks, blue drape, clean gloves with a Purell gel, measuring tape, alcohol swab, and steri strips. Place a mask on yourself and one on your patient. If they can't wear a mask, ask the patient to keep their head turned to the side during the procedure. Have family members don masks if they are staying. Place the blue underlayment drape under the shoulder or arm where the catheter resides. This will decrease contamination of the exposed site. Examine the dressing, catheter, palpate, and ask the patient about drainage, purulence, redness, swelling, fluctuance, bleeding, catheter integrity, warmth, and pain. Using the measuring tape to the kit, measure the external length of the catheter and compare it to the documented length. Open the extra chlorhexidine cleansing swab and use to clean the outside of the dressing and external length of the catheter using a scrubbing motion. This is to reduce the amount of bacteria and soil before removing the dressing. The chlorhexidine swab may also assist with loosening the adhesive on the dressing. If you need to, you can use the alcohol wipe in the kit to assist with loosening the dressing. Use the steri strips in the kit to secure the catheter during dressing removal. Loosen the edges of the dressing to make removal easier. Start removing the dressing by taking off the documentation strip and then the pants. Remove the dressing by pulling the dressing low and slow and away from the limbs of the catheter, taking care not to dislodge the catheter. If necessary, a few drops of sterile saline can be used to loosen the chlorhexidine gel from the patient's skin. Once the dressing is removed, carefully inspect the insertion site again. If there is a stat lock in place, remove it carefully. If you've used steri strips to secure the catheter, remove them now, taking care not to dislodge the catheter. Remove your gloves and perform hand hygiene. Open the blue packet of the dressing kit labeled 2, Applications. Being sure to only touch the 1-inch border of the blue sterile drape. Maintain sterility at all times during this procedure. Don sterile gloves. Separate the 4x4s and open the stat lock package if you're going to use the stat lock. Using one 4x4 to hold the catheter, pop the chlorhexidine swab and start by saturating the insertion site. Using a scrubbing motion, either hashtag or circular, work from the insertion site outward. Make sure that you do not go back to the insertion site. Scrub for at least 30 seconds. Using the back side of your chlorhexidine swab, scrub the catheter that was under the, Using the back side of the chlorhexidine swab, scrub the catheter that was under the dressing. Discard the swab and the 4x4. Allow the skin to completely dry. Open the skin protectant package and use the second 4x4 to handle the catheter. Place the skin protectant to the skin that will be under the dressing, but not under the chlorhexidine gel pad and the adjacent skin. Allow skin to completely dry. If you're going to utilize the stat lock, apply it now and ensure that the catheter is not dislodged. Prepare the transparent dressing by dog-earing the support tape to assist with easy removal of the support tape. Remove the backing of the transparent dressing, taking care not to touch the inside of the dressing. Apply the dressing with the center of the chlorhexidine gel pad directly over the insertion site. Do not stretch the dressing, as this may apply traction to the patient's skin and cause skin irritation or breakdown. Remove the support tape from around the transparent dressing. Apply the pants at the bottom of the dressing, under where the catheter limbs emerge. Remeasure the external length of the catheter and compare to documented length. Document date, time, initial, and catheter length on the documentation strip and apply to the dressing in a place where the insertion site is not obscured. Remove gloves and perform hand hygiene. Don new gloves and prime hubs for each catheter limb, keeping the saline syringe attached. Ensure that the catheter limbs are clamped. Remove one hub and scrub the bare catheter end with the antiseptic wipe of choice at your hospital for at least 15 seconds. Allow to air dry for at least 60 seconds. Attach the new hub and flush using the pulsatile method. Remove syringe and clamp catheter limb if not in constant use. If your hospital is using swab caps, apply it now. Repeat this process for each limb of the catheter. This is a demonstration of a central line blood draw and hub change. Obtain saline flushes, empty syringes for specimens, new positive pressure hubs, antiseptic wipes, gloves, blood specimen tubes, transfer device, and specimen labels. Determine which limb of the catheter is safe available to use for blood draw, or if a refill stick is necessary. Stop any infusions and clamp all limbs of the catheter. Ensure that the patient identifiers match labels. Educate your patient regarding the procedure. Perform hand hygiene and don gloves. Prime a new hub with a saline flush, leaving the syringe attached and the hub in its packaging for cleanliness. If there is a swab cap attached to the hub, remove it at this time. Scrub the hub for a minimum of 15 seconds and allow to dry for 60 seconds. Unclamp the line, attach a saline flush, and aspirate for blood draw. Once patency is determined, flush the catheter using the pulsatile method. Push pause 1 ml each. Leaving the same syringe attached, you can draw the required 10 ml waste and discard. Scrub the hub and allow to dry for 60 seconds. Attach an empty 10 ml syringe for your laboratory sample. Gently aspirate the desired amount for your specimen. Remove, scrub the hub, and allow to dry for 60 seconds. Attach a saline flush and use the pulsatile method to flush. Clamp the line and remove the existing hub. Scrub the exposed end of the catheter for at least 15 seconds and allow to dry for 60 seconds. Attach the new primed hub. Unclamp and flush using the pulsatile method. Remove the syringe and clamp. Transfer blood into your specimen tubes. Label your specimen with date, time, and initial. Discard used samples, remove gloves, and wash hands.